Okay, everybody, today with us is Jordan and Juan from InsightMedi. I'm your host Wojciech, and also with us is Jacob, one of the members of the BreakBox Lab. So, first question. Elevator pitch. Two sentences about what is InsightMedi.
InsightMedi is a health tech platform where healthcare professionals can share and discuss clinical cases without putting in risk the patient's privacy.
Okay, that sounds nice. So why are you doing it? What's your personal story, personal connection, motivations?
Well, InsightMedi started, it wasn't my idea originally. Gonzalo, practicing physician of over 20 years, orthopedic surgeon from Spain, had this idea of creating a platform that had the benefits of the social regular platform, but for healthcare. And he approached me, say, hey, I need someone from the technical side of things to help me build this product. So that's how I joined the venture. And then
I started my career as a nurse, and then I went back to school to get my master's in public health and business. And I was really looking for that perfect combination of both. How I can use that healthcare knowledge and then at the same time use it for entrepreneurship.
Okay. So what's the problem that you're trying to solve?
You want to tackle the problem?
Sure. So collaboration in healthcare is very important.
Mm-hmm.
Every day, doctors are sharing patient images and patient information with each other. The reason for this is because they need help sometimes in difficult cases, and also they just want to learn something. The problem is that they're using tools like WhatsApp, Facebook, Instagram, and these are not safe. So what we did was we built a platform that has the tools to make it safer while encouraging this vital collaboration.
Okay, so you're making the Messenger or WhatsApp just available for doctors actually, right? So they don't broke any law.
Exactly. So it is compliance with healthcare regulation, at the same time enabling this very important sharing that happens every day anyway, but they just don't have another way to do it.
So the idea is to bring the benefits of those platforms that they are already using. You mentioned WhatsApp, just is one component of it, the messaging part, but also you can think a little bit more of like a LinkedIn. It's a professional network where people can share content, in this case mainly clinical cases, and then they can do whatever they're doing right now, which is engaging for consultation purposes or education purposes, but they can do it on InsightMedi when we take care of the compliance level and we give them additional tools so they can protect the patient's privacy before sharing it.
Okay. Okay, so I think the favorite investors question, where's the money?
So we think the money right now for our company is in the hands of healthcare institutions. So there are several segments that you can think of, but the main ones could be hospitals and universities. So for consultation and for education. The business model that we have set up for InsightMedi is very simple. It's just a yearly license of starting at 39 euros per active user. We want to make it active users because we want to make it value based. We don't want universities to be or our hospitals to be worried about the amount of people that have access to it. We want them to charge to be paying only for who's using it, so who's getting value out of it. And we also offer better plans so they can upgrade to more advanced combination of features in case they have different needs.
I have the chance to listen to your pitch. So many times I also saw it, of course. Can you tell me something about your partners, the universities that you're collaborating with?
Yeah, of course. So we have one very early adopter, internal champion, we call it, which is the dentistry school at Temple University. They discovered InsightMedi 3.5 years ago, and they loved the idea, but we didn't have the product that they wanted. So we just kept getting the feedback on what is it that we can create, how can we change what we have right now to make it more valuable to you, and that's how they became pretty much collaborators. So we have a collaboration agreement where they help us with money and experience, so we can build what they want, and this is the product that we are now opening for all of the institutions. This is a great partnership not only because it gives us a little bit of validation, which is very much needed, but also they, as many of the US-based institutions, they have a commercial mindset. So now what they want to do is take the collaboration to the next step and create a collaboration of commercialization. So we go and do business together. They open doors for us because they have the internal connection in the market. We build and support the technology, and hopefully that's going to take the business further. And we also have a new customer in Spain, which is a University of Islas Baleares. It's going to be using InsightMedi to teach anatomy, which is also very exciting. And we're opening different type of collaborations with pharmaceutical companies to explore the opportunities to use InsightMedi as a continuum medical education tool.
Okay, so one more time, because I know that's important for every investor. You already have some revenue, some traction going.
Yeah, we launched InsightMedi for institutions in this B2B product in April this year, and reception has been amazing so far. So it's very early on, but we have several pilots going on. It's very promising. People are getting engaged with the tool, and we are starting to, our path to revenue. Hopefully, we're going to close at least one more deal before the end of the year, and next year is going to be very exciting in terms of revenue generation for the company.
Okay, so we're all together here in Startup Bootcamp, right? So with Bilomo, you're with InsightMedi. What's your feeling about Startup Bootcamp?
The great thing about accelerator programs in general, and Startup Bootcamp is the same as the other teams. So yes, they give you resources. Yes, they help you improve. But really, it's what you get from the other teams here that I think is something really special, and something that's hard to replicate in a different environment. So I think that the one of the best things that we've benefited from is from each other, and helping each other, learning from each other.
I will just add a little bit onto that, because that is exactly true. And I've done this twice before Startup Bootcamp, and you always get help with the introductions. You always get good connections with potential customers. But the thing that I keep seeing happening more and more and more is that I keep in touch, and I have not only new friends, but also new potential connections with the industry that we're all working on, and those relationships still go to you like many years after the program. So I think that will be the most valuable thing.
Okay, so last question from me. I know you have another member of your team here, so just maybe show him.
You want us to bring him over?
Yeah. I think he's already here.
Oh,
this the mascot, our mascot of Startup Bootcamp.
This one.
We love him.
I thought you were talking about.
So with us also is Potter.
Yes, this is the morale booster at the office, I think.
Yeah.
Everybody just come to him when we have any stressful day and just talk with Potter.
He's the Chief Happiness Officer.
Chief Happiness, yes, CHO.
Yeah. You should include him in the pitching the team.
Yeah, you should. We're gonna do it. Sure.
We think Potter.
Yeah. Okay, so great guys. I think you got great product and the team is awesome. And seriously, the best pitch at Startup Bootcamp, the pitching guy right here.
And if you have any questions to InsightMedi, for Jordan and Juan, free to ask. I'm more than.
I think they will be more than happy to answer any questions.
Okay, yeah, for sure.
Yeah, thanks guys.
Thanks.
Thank you.
Thanks.